Let's begin by going over the specifics of this case. The patient, Miss A, who is an 87-year-old woman who had just received a hip replacement surgery due to a terrible fall, has been assigned under your care. It is also required of you, the nurse, to help her with many of her daily tasks due to a stroke last year which has affected her mobility. You become very upset because you have a negative impression towards older adults and would have liked to be assigned to a younger client. With this, you start to feel uncomfortable and conflicted because you feel that it is impossible to interact with Miss A, which is restricting you from building a strong nurse-client relationship with her.
Upon your first interaction, you help her with all her daily activities, like feeding and maintaining personal hygiene, but refuse to respond to any of the questions she has asked you. Once completing her morning activities, you remind yourself to go to the gym more frequently so you don't end up like Mrs. A. Towards the end of your shift, your clinical supervisor asks you about your experience with Mrs. A, and you realize that you have not successfully built a nurse-client relationship since you do not know any personal information on her from your interaction. Hearing about this, your clinical supervisor asks you to reflect using Paterson and Zderad's theory to optimize Mrs. A's care.
Let's discuss Paterson and Zderad's theory, which is the humanistic nursing theory. Humanistic nursing is based on nursing dialogue, which is used to foster one's well-being and well-being of those in need. It is deeply rooted in the existentialism of both the nurse and the client, as well as the experience of nursing. It is also a very dynamic process where the nurse learns to adapt to many situations they may come across, as well as learn from them to use for future use. Humanistic nursing is also multidimensional, which embraces being, becoming, and change. It provides reflection and articulation using various methods and bridges theory and practice by guiding nursing dialogue. The main focus of humanistic nursing is the ability to understand one's gestalts, which is the combined whole of a person, and relating it to health and difficult experiences to realize one's potential. Humanistic nursing also deals with the call and response. This call and response occurs through dialogue, nursing practice settings, and patterns of change. When it comes to call and response, the call comes from the patient, their family, community, or humanity with a health-related issue. The response comes from the nurse, a group of nurses, a community of nurses which responds to the caller. And in between call and response is and, which is the practice of nursing. The nurse or team of nurses who are responsible for the response use a practice of nursing to respond to the call and needs of the patient.
Paterson and Zderad focused on the nursing education and focused on experiences nurses should gain. They wanted their training to focus on the nurse's ability to relate to and interact with the patient in a scientific and medical background. They placed emphasis on the nurse-client relationship and developed humanistic approach. Authenticity is being original, showing and expressing your experiences professionally in a means to relate with the patient's situation. According to the CNO, an important skill which enhances nurses from any other profession in the health facility is to maintain a key relationship using nursing intuition, as well as applying caring attitudes and behaviors.
The humanistic model of nursing is an approach to nursing which encompasses of a number of individual theories, including Patricia Benner's From Novice to Expert model of nursing and Jean Watson's theory of caring.
According to Kornhaber, 2016 humanistic nursing theory is a dialogue that includes intersubjective transactions whereby a nurse and a client meet, develop rapport to relate meaningfully, and presenting the environment intimately and mutually. The theory further suggests treating the patients with dignity and love. Treating with dignity refers to handling the patient in a friendly and engaging in a discussion to understand the kind of treatment preferred. Different patients define dignity differently based on their philosophical, social, and religious beliefs. However, Dignity Care 2017 notes an ABC dignity pattern will be enable nurses to be neutral while attending to patients. The pattern is attitude, behavior, compassion, and dialogue.
Paterson and Zderad's theory emphasized looking at a person as a whole, or the patient in this case as a whole, rather than simply the reason that they're in the hospital. This means going beyond caring for their illnesses and injuries and connecting with them and caring for them as an individual. They believe that the patient can grow in a healthy and creative way. One of the best things about nursing is that when a patient goes to the hospital, nurses are known to make them feel more comfortable and allowing them to have the best experience that they can possibly have. In the Paterson and Zderad theory, it insists that the nursing-patient relationship does in fact affect the outcome. Paterson and Zderad's theory encourages nurses to acknowledge that their patient has their own set of expectations, values, and beliefs. The nurse that's caring for Miss A in this scenario should respect this instead of making general assumptions about her patient. Let's go over the assumptions she made in regards to Miss A that affected the way that she was able to care for her. 1. She assumed that she wouldn't feel comfortable with Miss A. 2. She thought that she would have nothing in common with Miss A. And 3, she thought Miss A was grouchy, narrow-minded, and living in the past. As we can see, these assumptions seem to be based off the fact that the nurse is caring for an older patient, but they may cause her to not realize that Miss A could be as mentally alert and intellectually active as she is. When applying humanistic nursing, which is a big part of Paterson and Zderad's theory, it's very important for the nurse to not make assumptions, stereotypes, or generalizations about the patient, especially since each individual has their own unique experiences, values, beliefs that shape them to be who they are. Everyone's different, and therefore they will have a different way to care for them and different needs. So in this case, trying to get to know Miss A better so she can better care for her would have been the goal for the nurse.
Attitude. Attitude refers to the preconceived ideas and emotions towards something. In this context, I already had a predetermined mindset that attending to old patients is not cool at all. I believe that they are temperamental, narrow-minded, and living in the past, and they cannot provide any help. Therefore, I, as a nurse, have failed to maintain a neutral attitude. It is also to my disappointment that I was assigned an old patient, contrary to my expectations, and therefore, to improve my care tomorrow, I will be open-minded and ready to serve the patient wholeheartedly. Additionally, when a person is very old and sick, normal metabolism and cognitive functions are impaired, which is reflected in the overall interaction. Behavior. Attitude dictates behavior manifestation. Nurses who are informed about their attitudes can properly manage their behavior. As with Miss A and my situation, I am extremely upset with how the client responds to my questions and the kind of questions I am asked. Additionally, she is not willing to cooperate with me. However, tomorrow I will begin by introducing myself more politely and inquire from her the kind of treatment she wishes. Sitting close to her and keenly listening to her will improve my interaction with her.
Using Paterson and Zderad's theory, let's look at how the nurse could have behaved to improve Miss A's care. For one, she should not have let her negative attitude influence her interaction with Miss A. It's possible that patients can sense the negative attitude from the nurse, and because of this, they can feel closed off. And it's really important that the patient doesn't feel closed off so that you can build a really good therapeutic relationship with them and get to know more about them. Instead, the nurse could go in with a positive and friendly demeanor, and that could also rub off on Miss A, who has to deal with having a new nurse. Another way the nurse could have behaved differently was by showing small but positive acts of kindness towards Miss A. She could have asked her if she was comfortable, offered a glass of water. Small acts of kindness go a long way, especially in nursing.
Compassion. Compassion is the nurse's inherent feeling of pain as experienced by the patient and the willingness to alienate the patient from it. Compassion is the driving force for the student to join nursing careers, as they have an inner feeling to care for other humans. From my interaction with Miss A, I lack a compassionate spirit. This is because I should have developed the need to care for her irrespective of the age. Therefore, from tomorrow, I will provide an understanding look and a therapeutic touch to her. This will promote the development of a compassionate nature to all patients.
Having compassion for the patient will really improve the communication between the nurse and the patient. In this case, the nurse should consider how Miss A could be feeling. She's dependent on her nurse for a lot of things, and having a new nurse may not be easy for her, especially one that's younger than her. Although the nurse is worried about how she'll feel seeing Miss A undressed, She should consider how Miss A would feel having to undress in front of a new nurse that is younger than her. The nurse can use these valuable insights into Miss A's life to improve how she acts and communicates towards her. In order to do this, she needs to be with Miss A as much as she can. In this case scenario, it's said that she would cut her food and then leave. It's really important to be there for the patient not only when you have to, doing the things that you need to do, to build that therapeutic relationship with them. In this case, at the end of the day, the nurse was asked what she knew about the personal aspects of Miss A's life, and she said she didn't know much. This could have changed if she had a different attitude, didn't make assumptions, had better behavior, and was more compassionate towards Mrs. A. Paterson and Zderad's theory would be so helpful in this case because the nurse would have been able to identify what Miss A was calling for, and she would have been able to respond in the best way for both of them.
Dialogue, exchange of information between individual providers, more in-depth information that improves the overall interaction. Within healthcare centers, healthcare providers need to gather more information about the patient in totality, not just the sickness. Dialogue between myself and Miss A will foster a sense of trust, honesty, and openness, improving my overall interaction. I will ask some questions that will evoke discussion and better interaction. For instance, do you consider meaningless at this point in life? Such questions will promote our interaction and in our long run will have good care. According to firstly, Paterson and Zderad arguably pinpoint three major concepts in improving the daily interaction between patient and nurse: response and dialogue. Nursing dialogue occurs when the patient meets a nurse. The nurse should be open and understanding of how the patient feels and experiences, with the sole purpose of improving the condition. Furthermore, the psychologists pointed out the phases of the nursing process as:
what could the nurse do to implement therapeutic relationship? For any nurse to implement a therapeutic relationship, one must always have a professional approach. In this case, they were not able to connect with the patient because of their generalized view and preconceived notion of older adults, viewing them as grouchy and narrow-minded. But the humanistic approach and theory allows one to identify a patient as a singular existence. It provides awareness and comfort and compassion because people want to know that they matter and that they matter to you. And the best way to make them feel that is to listen to them. Because essentially, the nurse is responsible for caring for the patient, but a solid and conceptualized interaction allows for the nurse to easily understand the patient.
How can the nurse look beyond her own assumptions to improve the nurse-client relationship with Miss A? In improving the nurse-client relationship with Miss A, the nurse must prepare themselves when coming to interact with the client, using the first phase of Paterson and Zderad's theory, which is preparation of the nurse knower for coming to know. The nurse must remove all of their assumptions, opinions, and ideas before getting to know their client. In doing so, she or he can start with a clean slate with their client and come to know her with full authenticity. To do so, it would be best for the nurse to consider how they might feel if roles were reversed, reflect on their own personal experiences and how they might affect patient care, and attempt to change their behavior in the situation in order to build a strong nurse-client relationship which focuses on the care and well-being of the patient.
Conclusion. The therapeutic relationship is based on mutual respect and trust in all patients. The nurse's ability to be sensitive to other feelings, physical conditions, and spiritual needs helps provide holistic care. Caring interaction develops when the nurse comes together with the patient, develops a dialogue, and finally achieves healing. Verbal and nonverbal skills may be used to provide good care to the patient. Whenever in doubt, active listening and inquiring are skills that all nurses should embrace as they offer services to all patients. Maintaining eye contact and interval smiles may positively influence the patient's participation in discussion, enabling the nurse to understand more about the patient. However, in all interactions, professional boundaries should be maintained.